UroPatient. Tune in and see. Empowering your health for you and me. You and me. Knowledge is power. We make it clear every Saturday morning. The podcast is here.
Hey, good morning. This is Vic Senese, and I'm with UroPatient Podcast, your perfect place to be if you want to learn more about urology health. Hey, be sure to do us a favor and like and subscribe. So today we're going to take another step into our prostate cancer awareness. So we've had to talk about the MRI. You got your MRI back, and whoops, they found something on there, and now they're recommending a biopsy. So just sign up, right? Wrong. Listen to this first because you're going to want to know what your options are, because there's different ways to do these biopsies, and it could make a difference as to what results you have, how much discomfort you have, and what side effects. So check it out. So if your doctor has recommended a prostate biopsy, you may have been wondering what are your options and which approach is best for you. Prostate biopsy is the only way to confirm whether suspicious findings from your blood PSA test, prostate MRI, or other evaluations are due to prostate cancer. Today, there are several biopsy techniques available, each with its own advantages, potential risk, and level of comfort. Understanding these options will help you have a more informed conversation with your healthcare provider and choose the approach that best fits your individual situation. Now, the good news is that in most cases, you don't have to make a decision about your prostate right away. Prostate cancer usually grows slowly, giving you time to gather information, ask questions, and understand your options before moving forward. Now, this is an opportunity to have a thoughtful discussion with your doctor about different approaches for biopsies, their benefits, potential risk, and which option best fits your personal health, your MRI findings, and overall risk. The more informed you are, the more confident you'll feel about the decision you'll make. Now let's take a look at the biopsy options so you know exactly what questions you should ask at your next appointment. Today there are two main ways of performing a prostate biopsy. The old traditional approach is what's called the transrectal biopsy, where the biopsy needle passes through the wall of the rectum into the prostate. Now whether that's done without or with MRI guidance, it doesn't matter. It's still going through the prostate into the rectum to get to the prostate. The newer approach is called transperineal biopsy. Again, can be done with MRI guidance or without, but it's where the needle passes through the skin between the scrotum and the rectum, called the perineum. Now, while both methods can accurately diagnose prostate cancer, they differ in important ways, including the risk of infection, the ability to reach certain areas of the prostate, and the type of anesthesia that you'll probably need, and your overall experience during the procedure. Because, hey, that matters. Now, take a look at these two illustrations. The picture on the left shows the traditional transrectal biopsy, where the biopsy needle passes through the wall of the rectum to reach the prostate. That's this one over there. The picture on the right shows the newer transperineal biopsy, where the needle enters through the skin between the scrotum and the rectum in an area, as I mentioned, called the perineum to reach the prostate. So two different ways to get to the prostate. So let's start with one of the most important differences between these two biopsy approaches, the risk of infection. Because the transrectal biopsy passes through the rectal wall where bacteria are naturally present, there is a small risk that bacteria can enter into the bloodstream or the urinary tract and cause an infection. The transperineal biopsy, on the other hand, passes through clean, sterilized skin rather than the rectum, which can greatly reduce the chance of getting an infection. Now, although the overall risk of infection after a transrectal prostate biopsy is low, it's not zero. And I always kind of kiddingly tell patients that if it's a 1% risk and it happens to me, that's 100%. Keep that in mind. Because the biopsy needle passes through the rectum, bacteria can occasionally enter the bloodstream or urinary tract in about 1 to 3% of patients. So this can lead to a serious infection requiring hospitalization called sepsis. and sepsis is no joke. It's a life-threatening condition that requires immediate medical treatment. In contrast, the transperineal biopsy avoids the rectum altogether, making the risk of a serious infection extremely low, almost close to zero in modern studies. The difference in infection risk is one of the main reasons that many urologists are now increasingly recommending a transperineal approach. So recently, on my other show, Uro Nurse, I had an expert in prostate cancer from Scotland. Yeah, Scotland. And we discussed how the approach to prostate biopsy is changing around the world. She explained that many European countries are now moving towards transperineal biopsy approach as the preferred method because of its lower infection risk while maintaining excellent diagnostic accuracy. So you can see there, and from this thing up here, the European Association of Urology, the EAU, has considered this now a strong recommendation that we shouldn't even be doing transrectal. I got to tell you, Europe's always been a little bit in front of us with prostate. Now, let's talk about another important part of the biopsy experience, discomfort. While the transperineal biopsy offers advantages such as lower infection, some patients may experience more discomfort at the injection site where that local anesthetic is given. So going through skin, you're going to go through it with a needle. You're going to have that area numbed down somehow. Studies have reported that pain at the injection site in a higher percentage of transperineal biopsy patients compared with the transrectal approach. The good news is that the discomfort's usually brief and localized and related to the procedure day itself. Many patients describe the soreness as similar to a bruise or tenderness in that area, and it typically improves quickly. In fact, while more transperineal patients may notice some discomfort on the evening of the procedure, the takeaway is that this is short-term discomfort and must be weighed against significant reduction in infection risk and other benefits from the approach. So, the transperineal biopsy approach has some unique characteristics. This approach can provide excellent access to areas such as the apex and anterior zones of the prostate, which are sometimes more difficult to sample with traditional techniques. Because these areas are closer to the urethra, some patients may experience temporary inflammation or irritation after the procedure. Now that can lead to a slight increase in urinary symptoms, especially since we're doing this on generally men that are starting to have some enlargement of their prostate. Things like frequency, urgency, weaker stream, and some unable to urinate at all. About 10% higher risk of temporary worsening of urinary symptoms compared to a transrectal biopsy, because we're staying away from that urethral area. Now, the important point for patients to know is that these symptoms are usually short-lived and improve as the inflammation resolves. Also, neither transperineal or transrectal has been shown to cause any changes in erectile function. That's good news. So, the bottom line is that transperineal biopsy approach offers several important advantages for patients. Because the needle can better access certain areas of the prostate, including regions where cancer can sometimes hide, it may help detect clinically significant cancers that could otherwise be missed. Another major advantage is that very low risk of infection, which often means patients may not need the same level of preventative antibiotics used with transrectal biopsy. There is a trade-off. The trade-off is that some patients notice more discomfort during the numbing injection and often described it as a brief pinching or pressure sensation, and some may experience temporary urinary urgency or irritation for a few days afterward, as we had mentioned. Understanding the pros and cons helps you make an informed decision with your urologist about the biopsy approach that best fits your situation. Now, since many prostate tumors are now being identified because of findings on a prostate MRI, one of the most important things we need to discuss is location. Where a suspicious area is located within the prostate can influence which biopsy approach may provide the best chance of accurately sampling that area. Now, some lesions are easier to reach through traditional transrectal route, while other, especially those located in the front portion or anterior areas of the prostate, they may be better accessed through a transperineal approach. The goal of a biopsy is not just to take samples, but to make sure we're sampling the right areas of the prostate to find clinically significant cancer while minimizing risk and side effects. A lot of stuff to think about. So this image here shows the suspicious target nodule located at the anterior portion of the prostate, which is the front part of the gland and sits way up there, farther away from the rectum. Because of this location, reaching this area with traditional transrectal biopsy can be more challenging. The next image that I'm going to show you will help explain why the transperineal approach may provide a better pathway to access and sample patients with these harder to reach areas. Again, improving the ability to accurately evaluate suspicious findings on MRI. So we can see from this picture here, looking at this nodule, the black area that says hypointense, that where that arrow's at right now, that's the rectum. So you can see that the location of a suspicious nodule with relations to the rectum is marked by this arrow. With a transrectal biopsy, the needle has to travel through the rectal wall and reach the lesion. Now, if it's low, close to the rectum, no big deal. It's right there. The tissue is paper thin that it has to go through. However, as we see that this particular MRI shows that that lesion's way up towards the top, and as we have to work our way all the way up to the top, it's going to be more challenging to push that needle through transrectally all the way up to the top of the prostate to get good samples through there. And whenever you're pushing a needle through that much tissue, it can get deflected a little bit, making it, chances are that you could miss that lesion itself. And that's the area that you want because that's the most suspicious. So let me go ahead and I'm going to put a picture of the outside skin of what it looks like for doing a transperineal. And that's this area right here. So you can kind of see I marked off the anus over there and the scrotum's up there. And this area that says press here, well, that's not for pressing, that's marking out the transperineal area. Now I put this over the MRI. I'm going to change the opacity so you can see how we would be taking a needle and going through that area where it says that press here. We would push the needle this way, straight through it. So let's tune this down and we can see right there, see how we could go right through that spot and go right in and target that. So in this particular patient's MRI, transperineal is going to be a big plus compared to doing a traditional transrectal because, again, coming from the bottom, as we showed earlier, through all that rectal tissue is going to be much more difficult. Where this one here, we can go straight in with the needle this way, right in there and sample it. So let's compare the transrectal versus transperineal prostate biopsy approaches. When it comes to cancer detection, the transrectal approach is a good technique, but it misses some tumors, especially those located in the anterior portion of the prostate, with studies showing that up to 23% of anterior tumors may be missed. So transperineal approach has the advantage. It gets the check mark because it provides excellent access to the entire prostate, including those harder to reach areas. When we look at infection and sepsis risk, transrectal biopsy carries a higher infection risk because the needle passes through the rectum, often requiring preventative antibiotics, while the transperineal approach has a dramatically lower infection risk and is increasingly being adopted as a preferred approach worldwide. So again, transperineal gets a check mark there. Now, when it comes to procedure comfort, the transrectal approach may have an advantage, with fewer patients reporting significant discomfort, while the transperineal biopsy can involve some more noticeable discomfort from the numbing injection. Finally, for recovery, so check mark to transrectal. Finally, for the recovery and side effects, transrectal biopsy may result in fewer temporary urinary symptoms, while transperineal biopsy can have a higher chance of short-term urinary urgency or irritation as the prostate recovers. The key takeaway is that each approach has advantages, and the best choice depends on your MRI finding, prostate anatomy, cancer risk, and personal priorities. So, one important factor I haven't discussed is that not every urologist currently performs transperineal biopsies or has the access to the equipment and training needed for this approach. As with any procedure, experience matters. So this is an excellent question to bring to your urologist. Do you perform transperineal biopsies? If so, how many of them have you done? You know, you can always pick people that have done a lot of these and maybe you have to drive a little further to get somebody with experience, but understanding your provider's experience and the options available at your center is an important part of making that informed decision. Now, hopefully you have the information and the questions you need to have a meaningful discussion with your urologist about which biopsy approach is best for you. Remember, there's no single perfect answer for every patient. The right choice depends on your MRI findings, prostate anatomy, personal risk factors, and individual preferences. So, what you need to do is make sure that you get out there and you ask those questions. Remember, where's my prostate tumor at? How easy is it going to be for you to reach it using your method? Do you do transperineal? Because I'm concerned about infections. What's my risk that I might have something like urinary retention because I've got many prostate problems? All these things come together and you have to weigh them all to get a good, accurate decision that you should make with the help of your healthcare provider. Hopefully this helps. See us next week.
From research up